I understand that government it can't spend more than it takes in, but it's about relative priorities. And my issue is I believe that rural healthcare is being deliberately underfunded without really understanding what's happening. Legislators need to be educated that rural hospitals are the safety net. If I'm living in Brunswick, maybe I should pick a different community, but I already said it. They've got two big hospitals, Parkview Adventist and Mid-Coast. And there's a question whether Parkview Adventist should exist. Even if it doesn't, even if it goes away, people that live in Brunswick have 3 other hospitals within 20 minutes that they can drive to. How long does it take us to get to another hospital if we can't go to the Downeast Community Hospital? You all know the answer. So should there even be a question downstate? Or should we relook at our priorities and say, rural healthcare is so important, it's so vital, that we're not going to tamper with the system. I don't know how to make a profit, even without these changes. I'm engaging our entire board right now in that conversation. We're trying to solve that problem. I've got 2 trustees and a corporator in the room, and they're struggling with this issue because I can't do it by myself. I used to think I could, but I can't do it without the input of a group of trustees that can also help me figure out the priorities and what the community needs. So, yes.
What percentage of your total billing is Medicare, Medicaid?
66%.
What happens to the other 33%?
Well, a percent of that is business that we sell to ourselves. It's our employees and our insured folks. Another 3% of that is bad debt and charity care. So we're really close to 70%, where it's either no pay or less than cost that gets paid. So that 30% is commercial business. So when the State Employee Health Commission, which is commercial business, came to us and said, you guys are too expensive, give us a discount. We gave them a discount. But now that's money that was supposed to offset the losses on Medicare and Medicaid. And so my issue is, if you're going to start tampering with the system, understand, if you're going to cut commercial rates that you're willing to pay to hospitals, that's going to send them into the red. And who's going to make it up? I can't tax my way out of that. I am going to go to the governor's office and ask for a grant. I don't stand a snowball's chance anywhere with that one. I'm also going to be going to our federal representatives and state representatives and ask for an emergency bill to adjust critical access hospital reimbursement.
Of that 30%, some of that is private pay, some is paid by other insurance companies.
Yeah.
What do they pay to cover your costs?
They all get a discount. It's a negotiated discount. For every payer, it's different. With Anthem, they're particularly powerful. I can't share with you because it would create problems in negotiation. But they get a good discount. And there was a time when I could live with that discount. But when you get random things like the State Employee Health Commission and the University of Maine system coming to us and saying, wait a minute, your prices are too high. We're unwilling to share the data with you, but your prices are too high. So give us a discount. It's awfully hard to say no. And frankly, we're probably going to get to a point where we go back to each of these people and say, we're not going to honor your discounts. We need to renegotiate. This community needs a hospital. There are people in Augusta, Portland, perhaps Bangor, that aren't sure that every little community like ours needs a hospital. We live here, and I don't want policymakers that have never been to Machias, Maine, or Millinocket, or Holden, or Calais, making these decisions and grand pronouncements without understanding that there are people that are going to die in the back of ambulances unless we've got hospitals in those communities. I can name specific patients. I won't, but I could name this earth today if it weren't for Downeast Community Hospital. And all the other rural hospitals, I know they can do the same.
Any money coming from the liquor commission sale that's coming up?
Well, I joke with you and say you'd really help us if you drank more. But that money isn't flowing yet. I guess that's a...
I mean, is Machias Hospital owed money from the state?
$734,000 is what's owed to us. It's money that some legislators said, well, maybe we should give you that money, but we won't help you out with the 109, 101% issue. And I said, well, that sounds like you say to a deadbeat dad who says, well, I'll either pay child support or I'll start paying it now, but I'm not going to do both. Well, what's fair? You pay your old debt, and then you pay us for the work that we do in the future, because our volume doesn't go down just because you're not paying us. You know, so to answer your question, the negotiations haven't finished. There are differences between the two parties, and there's a surprise. and the governor himself probably has a third view of things. But the reality is, both parties are arguing we need to pay the hospitals. We just have different approaches, and it probably involves the liquor money. And I don't care where it comes from. I just think it's a legitimate debt, and I think the state has not honored the Constitution by honoring its debts in the year that they're incurred.
The governor is talking back and forth in regard to the national government in regards to expanding the Medicaid program to include more people at 100% or 110% or whatever they were talking about and for 10 years. And could you comment how that would help or hurt the hospital?
Well, it helps the hospital in the sense that more people will be insured, and there'll probably be less charity care, in other words, less free care that we provide. So it's definitely a help to the hospitals. The thing that the governor is struggling with, and I think we pretty much all understand this, is that it's kind of a sucker's bet. For 3 years, the government will pay for that cost, but after that, the states have to pick up 10% of that cost, and so naturally we're all cautious about taking something on that's essentially an unfunded mandate.
He wants 100% for 10 years.
Well, somebody said in the media said, I'm not sure that was even a serious offer. I don't know what it was, but I've got to honor the guy for being frank. I'm really scared about because Maine is a vulnerable state. We can't tax people forever. We've got to get a hold of costs. And so when I go to talk to our legislators, Larry Bachman is a very conservative Republican, and I've got to honor the fact that he looks at like Greece and says, do we want Maine or our country to be like Greece? And the answer is no, we don't. So I've got to be cautious that when I say I want to still get 109% of reimbursement, or better yet, 117% of allowable costs, that I'm not part of the problem. But I think it's relative priorities. I think there is money in the system already, not even looking outside of healthcare. Let me give you just one example. If you come to see a local doctor and they're trying to diagnose your whatever, and they order an MRI, and then they say, I've seen something and I want you to go to a specialist in Bangor. What's the first thing the specialist in Bangor is going to say? I want a new MRI. And sometimes what they say is, well, the film was kind of fuzzy from Machias. And we believe them when they say that. I'm going to tell you right now, if a doctor says that to you, say, bull.